Meet the medical coder. In the UK's national health system, they are a vital link between clinical care and hospital funding, but their workload is exploding. A typical trust has 90,000 annual admissions, and long-stay cases can sit in a backlog for weeks. The system loses £1 billion a year because of this. Just by saving 15 minutes per case, we can reclaim over 21,000 hours. We aren't just replacing coders, we're giving them the capacity of 13 extra teammates to finally clear the backlog. Introducing Cogstack Coder, an agentic medical coding system. A dual AI pipeline system with MedGemma 1.5 to tackle the clinical coding crisis. Coder is our vision for a modern and intelligent coding interface. We are Sam and David, two clinicians with experience in ML research and operations. We are co-developing with a NHS partner to ensure that there is clinical safety and also technical rigor. In our stack, Google's Agent Development Kit orchestrates MedGemma 1.5 and performs entity recognition via Google's lang extract as a tool. Because NHS data is sensitive, our backend uses VLLM to run open weight models locally in production, with lang fields and post-hoc in tracing. Our unique agentic workflow doesn't just read text, it also reasons, and we use a parallel execution to combine both the clinical reasoning of MedGemma with MedCAT, an in-house NHS validated NLP model to ensure that our entity recognition is both innovative and grounded. In the Coder UI, agents perform autonomous document search to find relevant evidence for billing, which as lang extract identifies clinical entities, while semantic search ranks the most probable codes for the user. Crucially, this is a human-in-the-loop system. The agent presents the evidence and why behind the code, and the experienced medical coder makes the final clinical decision. The killer feature for NHS adoption is not just accuracy, it's also data sovereignty. And because MedGemma is an open weight model, Coder runs entirely on-prem. So this ensures that the patient data never leaves the trust secure environment. In our lang extract pipeline, it provides the clinical understanding necessary to distinguish between acute and chronic conditions. So generic models often miss this. MedGemma evaluates the whole clinical narrative to justify its selection. And beyond extraction, we also use MedGemma for re-ranking prioritization of codes for the highest clinical importance. And finally, it condenses months of patient history into precise summaries, allowing the coders to grasp the full clinical picture. By automating evidence gathering, we project a 20% increase in coding throughput, and for tertiary hospitals, this ensures timely remuneration and sustainable care. Co-developed with NHS Trusts, Coder aims to show that we don't have to choose between AI and patient privacy. By merging MedGemma's reasoning with an on-prem agentic stack, we are building a solution that is clinical grade and ready for the front line. We are Sam and David. Let's build an AI-ready NHS starting today.